Hi, my name is Dr. Carlos Wesley, and I just wanted to share some of our early results from our hair survival studies comparing traditional FUE versus our new approach. Now, firstly, I would like to sort of explain how we did these studies. Patients came in and had one of two or even three different types of grafts placed in particular parts of their head. Those were identified with tiny tattoos that were made. We would clip that area and place either anywhere from 10 to 30 grafts in each of those areas. The investigator was blinded to which was which, left or right or center, where the grafts were placed. But using a folliscope, we then looked at the sites in which the grafts were placed and did a comparison of day 0 versus a few weeks later or a few months later, depending on the patient. And we were able to see the growth and how it differed from one type of graft to another. Also, using software, we were able to superimpose images from when the grafts were placed versus when they grew over time. And that's how we were able to effectively get our hair counts. We charted them, but I think the best way to present it early on is just to show you the numbers. Now, this graph represents a direct comparison of traditional FUE graft growth versus our new approach to FUE graft growth. Each patient is its own column, and you can see in the first patient at 3 months there's the same hair survival between FUE and this new approach. However, at the 5th month there was better hair survival with the new approach, and at 13 months that improvement in hair survival expanded. In patient 2, the growth of the new approach was significantly more. FUE started to catch up around the 4th month, but then at the 15th month there was still considerably more growth of the hair taken with this new harvesting approach. It's not always the case. In patient 4, you can see at the 2nd month the FUE growth was actually better than our test grafts, but then at the 11th month the survival of the test grafts started to exceed that of traditional FUE. There's a few patients that we've only had early counts on, and we'll continue to get those as the months go on, but these results are very promising. And I do have every intention of presenting our final findings at the ISHRS conference in October of this year. Thank you very much.